Welcome to Doppelnamers, where we connect the dots between people who share the same name. My name is Elizabeth Russell, and this is the story of my doppelnamer, a pioneer named Elizabeth Russell, who was tried for murder in Eau Claire, Wisconsin in 1892. At the time, it was the most famous murder trial in Wisconsin's history. With me are my good friends Mary Jean Stead and Kathy Boyle Almeida. Neither MJ nor Kath knows anything about the story. They will be meeting the characters and hearing the facts right along with the listeners. MJ, Kath, you've heard most of what we know about Elizabeth Russell's trial, and pretty soon you are going to deliberate as though you were the jury.
I'm ready.
Me too.
Before you go fill out your sandwich requests for the jury room, we've got a special guest. I thought it would be helpful for an actual doctor to weigh in on the medical parts of the case, just to supplement our usual source of research, which is
Wikipedia.
So I invited Dr. Judith Ziegler to join us in today's episode. I sent Judith an outline with some of the testimony you've heard about Bertha Erickson's symptoms and also Elizabeth Russell's, quote, spells. Mm-hmm. So you can ask Judith about the medical questions we've been tossing around. A real jury couldn't actually do this, search for their own evidence. But once again, there are no rules, and we're just going to try and get to the bottom of what might have happened, which we will get to in just a moment. But first, as always, we share somebody else's doppelnamer story. So, Judith, William Frawley was the district attorney prosecuting this murder case against Elizabeth Russell. And if you have ever wondered why lawyers have a bad name, it's because of guys like William Frawley. As we've heard in the last couple of episodes, he unleashed an arsenal of outrageously dirty tricks. Anyway, in the last episode, we learned that one of Frawley's goons was named J.W. Moriarty. He's the guy whom Frawley instructed to go plant evidence at Elizabeth's farm. Well, a generation later, there was a young woman in Eau Claire, a nurse, named Helena Moriarty. Mm-hmm. I don't know if she was related to J.W., only that they both, a generation apart, had roots in Eau Claire. Well, for her entire adult life, Helena lived with another woman whose name was Hazel Brown. And the most remarkable thing is that in the 1940 census, Helena is listed as the head of household, and Hazel is listed as Helena's, quote, partner. 1940.
Wow.
Now, according to Wikipedia, homosexuality wasn't decriminalized in Wisconsin until 1983.
Oh, wow.
1983. So this is 1940. Their listing was the same in the 1950 census. And sometime between 1940 and 1950, Helena adopted a teenage girl whose parents had passed away. So the 1950 census again lists Helena as head of household, Hazel as Helena's partner, and then it also lists the adopted daughter. And here we go, doppelnamers. The adopted daughter's name was Judith Ziegler.
Oh, wow. That's very cool.
There you go. That's wild.
Have you met anybody with your name, Judith?
I have never met anyone with my name, but there was a doctor practicing in Texas called Judith Ziegler.
Well, Judith passed away in 2020 at the age of 85. And in her obituary, it said that following the deaths of her parents, Judith had been, quote, lovingly raised in Eau Claire, Wisconsin by Helena Moriarty and Hazel Brown. Cool story, huh?
Yeah, that is.
Cool.
Before we get to our Judith Ziegler, I have to make one correction from something that we talked about last time. MJ and Kath, one of you asked whether Elizabeth would face the death penalty if she were convicted. And articles had hinted that this was the case, but I just looked it up, and the answer is no. Wisconsin abolished the death penalty in 1853.
Oh, okay.
And has performed only one execution in its entire history as a state.
Wow.
Okay.
And according to Wikipedia, no other state can make that claim.
Wow.
Oh, really? She was only threatened by Frawley and a few others.
The lynching.
The state would not have executed her, but
Just the lynch mob.
the
proud of
citizens might have.
Yes.
So if convicted, Elizabeth faced life in prison, not execution.
Okay.
Okay, so Judith, we have so many questions. Before we start, though, how about you introduce yourself to MJCAF and our listeners?
I'd be happy to. I
Okay.
went to medical school in Maine when I was 30, which was very old, back in the 80s. And there were only 7 women in my class. And I had 2 kids and a very nice husband. I did my residency in family medicine in Bangor. And we moved back to Portland, and I worked in Portland, Maine, doing family practice, delivering babies and general care. And then in my 50s, when my kids were launched, my husband and I moved to New Zealand, and I was employed by an organization run by the Maori, the indigenous people of New Zealand. And then my kids decided to have babies, so we moved back to the States, and I didn't feel that I could practice in the U.S. again after having worked in a country with socialized medicine. So I started teaching, and I teach second-year medical students now, and I love it. I have no qualifications for the task at hand today, except a curious mind and many, many years of reading mysteries and watching forensic crap on TV. When I was a resident in Bangor, we all had the opportunity to do work with a medical examiner for $25 a dead guy and just document unattended deaths and decide whether or not they needed autopsies. So I have some familiarity with the dead, but I'm not a pathologist. But I've read a lot about poisons.
That's where we need your help.
I think this is going to be fantastic. Judith, do you have any questions?
The questions that I have would be more of a conclusion. For example, why the heck were they so keen to punish Elizabeth? What did she do to piss them off so they wanted to frame her for murder if indeed she was innocent?
The evidence that we know suggested a few things. She had been sexually aggressive with this younger man,
Right.
which, being a cougar back then was not cool for societal standards. And she was just a very independent woman. Her husband was never home because he worked in the woods. And she ran the business. She was a business person. She held property in her own name. We heard stories about threats of lynching from people in the community.
The White Cap Group, was that what it was called? And of course, our prosecutor.
Yeah.
It almost makes me think of the Salem witch trials. If she did kill her, what might have motivated her? Sexual jealousy?
I think that was a theory that the prosecution was trying to whip up.
Right.
Yeah. It seemed to be how the press was certainly painting it.
And the fact that they got married quickly without her being aware of any courtship, I think came out of the blue for Elizabeth.
I think they also started to make her seem a little crazy, like with those spells that she was having.
And 2 instances of that, because right after the Peeping Elmer incident, she was jealous because Peter was playing checkers with that other girl who worked at the house. And remember,
Right.
she went out in the barn and fired a gun?
Yeah.
Oh, yeah, that's right.
She went out to shoot just to make them worry about her. And that was almost certainly out of jealousy.
Yeah.
Let's get to our questions for Judith.
Judith, it seemed like the arsenic was found in her organs after the autopsy. But is that something that was either used for cosmetic reasons at that time period or to induce abortion if in fact she was pregnant?
First of all, it's important to know that arsenic was found in a huge number of household things, including children's toys, wallpaper, clothing, green dye. It was a ubiquitous substance. Down the track, I think you might ask me about 2 kinds of arsenic. There are actually a dozen kinds of arsenic at least. We break them into 2 sectors, organic versus inorganic. Organic simply means it has a carbon molecule. Inorganic means it doesn't. The organic arsenic is found in a lot of foods, soil, water, and generally is non-toxic. Inorganic kind does not have the carbon molecule and it's very toxic. It is possible to have a high arsenic level found in organs or body fluids and have it actually be innocent. Rice, for example, has arsenic, seafood, shellfish. So that's something to think about too, is that even if she had arsenic, it's hard to know. I looked very hard to find arsenic used as an abortifacient, something to cause abortion. And it wouldn't be very good at it, simply because more often it would kill the mother. So it wasn't something that a woman could take to cause the loss of a pregnancy, because in an amount enough to kill the fetus, it probably killed the mother. It's important to know that arsenic was often used as a poison. There was a great book that's all about arsenic used as a poison through the 1800s. Somewhere in the middle of the 1800s, they actually started to have the equivalent of life insurance. And when that happened, along came arsenic poisoning. Oh. And they actually, this is the part I love, ready? They referred to arsenic as inheritance powder.
Oh,
right?
Wow.
Well, there's a woman called Mary Cotton in the UK that ended up being found guilty of murdering several of her excess children. So poisoning by arsenic was definitely a thing in that time period.
Yeah.
I didn't really find much having to do with it used as a remedy or a medication or anything along that line. It was used most famously as a rat poison, and it was around most farms. It also is a byproduct of a lot of smelting. And if you think about like London, for example, in the mid-1800s, the hideous pollution. So it wasn't hard to find in that time period.
Right.
In terms of how it shows up, it mostly is found in the urine, and the organic especially is excreted pretty quickly out of the body. The inorganic formulation can go into the liver and kidneys. And there was a fellow called Dr. Marsh who in 1840 devised a test to be done post-mortem to look for arsenic in the organs. But it was a little bit complicated, and not to poo on the very advanced state of Wisconsin, but one wonders if that would have been available to a simple country pharmacist back in the 1800s. So whether or not somebody could actually post-mortem test her and see whether or not there was arsenic, hard to know. It doesn't sound like it was something that was commonly done by country docs back in the day.
So you're saying that if she had arsenic in her liver or kidneys, it would have been very difficult to test for that back then?
I think it would have been easy to test in an academic center that had the test, but I'm not sure that it was something that was commonly done. It involves hydrochloric acid, copper tubing, and water, believe it or not. And you put it into suspension and you send it through with heat, and it has a certain residue. It also did say in the stuff that I read that it could be misinterpreted. So it's possible that if the test was not done faultlessly, it might have a false positive. So that was the thing that really jumped out at me the most, was like, how the heck were they able to figure this out at such a high level? Like now we would do it with mass spectrometry and all kinds of fancy stuff that obviously weren't available then. So that theoretically, it is possible that if she was poisoned and they got tissue post-mortem, they may have found arsenic in those organs. But it feels like a stretch to me.
So that's tissue. Talk to us about the test that the local, not even doctor, but druggist did on this apparent jar of stomach acid.
Yeah, so I found out the stomach isn't that big to begin with, and the amount of fluid post-mortem, especially, 6 weeks post-mortem that they dug her up, very little stomach acid, as little as 20 cc's, as much as 100, which is less than half a cup of fluid. So it would have been a very small jar. So I think that's a stretch. And I really didn't find anything saying that you could isolate arsenic in stomach fluid. So they may have had a big jar full of yellow fluid and brought it in front of the jury or brought it in front of someone. It's a stretch.
Especially in light of how rustic the situation was for the autopsy. Like, what did you say, it was on a slab in a barn? It's like, I don't know if they had the highest medical equipment, and certainly not the testing that you're talking about.
That was my feeling too, that you could probably find pretty much anything you wanted to find based on the way they did things.
And what happens to someone when they're poisoned with arsenic?
Well, that's the interesting part, Kath. And one of the reasons why it was such a clever way to get rid of somebody is it mimics many of the symptoms that people had back in those days. If you think about hygiene and people were eating spoiled food, so it was very common for people to have gastrointestinal distress, diarrhea, vomiting, stomach cramps, and that's pretty much what arsenic will cause. So again, there are two things we can look at. One is an acute poisoning where you mix it in with the drink, they take it, boom, boom, they're dead. And the other would be a slow poisoning over a matter of days or weeks. Again, the symptoms mimic greatly gastrointestinal distress. So if a mother was killing her child, no one would be suspicious because all the kids on the block had diarrhea. None of that would be considered remarkable.
The reason I ask is because I thought there was a lot of blood on the sheets.
The mattress was described as filthy and soiled, and the implication was by blood.
So would someone who has been poisoned with arsenic bleed out at the end?
I wouldn't think so. And I mean, there's talk about her coughing so hard she had a nosebleed. If she wasn't pregnant and was trying to fake a pregnancy, maybe she was hiding menstrual fluids. Or if she was pregnant, maybe she was losing miscarriage. Hard to tell.
So when Peter brought Bertha to live at Elizabeth's farm, the testimony seems pretty clear that Bertha was already suffering some kinds of symptoms. And over time, they called two different doctors, and the doctors prescribed these weird things for her. And we're wondering if you can tell us something about those substances and whether they might have worsened her symptoms.
I would say unlikely that they caused her death, but certainly they could have caused some of the symptoms that you described. I think that a lot of those treatments were tinctures. And if you think about it, like nowadays, you say, give him 2 pills every 3 hours. The concept of what's a drop. So I think it was not uncommon for people to be overdosed with whatever they were being treated with. So it's certainly possible that some of the substances given to her actually caused the worsening of the symptoms. Like the nux vomica can help vomiting, but it can also worsen it. So depending on how much, and even today, it isn't uncommon for people to be, oh, you still have a headache, take some more Tylenol. But back then, if you think about what a tincture is.
What is a tincture?
It's suspension. And this is the other good part about all these things. They're all made in alcohol. So, it's not just you're getting 2 drops of whatever the supposed medicine is. You're also getting a little whop of alcohol. So that caused people to kind of overdose on things as well. So basically, they're potentially toxic, but not lethal. They easily could have been misused or overused, either nefariously or accidentally. They certainly did not help her, but I doubt that in and of themselves they would cause her death. So if she was murdered and the arsenic was the cause, having all of those things additively wouldn't have been great for her.
So back to the arsenic, it's coming to prominence and being the inheritance powder. Yeah. That being the case at this time in history, if that had become well known, it was kind of a thing. Would that have been a handy way to craft a case against a person?
I think for both reasons. If somebody did murder her, if you're asking, did they know about it? I would say absolutely. I think it would have been common knowledge, and their ability to get their hands on it, especially on a farm, would be very easy. And if someone was going to set up somebody for murder, same answer. Everyone knows arsenic is toxic. Everyone knows it's on the farm. So if they're pointing a finger at Elizabeth, it would be a simple thing to accuse her of using arsenic.
It would be available. She would have an opportunity.
And if you're a pretty uncreative district attorney with few skills, you're like, let's make it arsenic.
Yeah. I found the book that I was telling you about, which is called The Arsenic Century, How Victorian Britain Was Poisoned at Home, at Work, and at Play. And it basically says grocery stores sold biscuits, sugar, flour, rice, and arsenic. So it was everywhere. Wallpaper, beer, wine, wrapping paper, insecticides, clothing, stuffed animals, on and on it went. So if he was going to accuse her of poisoning with something, my guess is that would be the most obvious choice. And because her symptoms were gastrointestinal, and that's what arsenic causes, it makes sense. She has vomiting, she has diarrhea. So it was a smart choice if they were setting her up.
So Judith, I know you mentioned the nux vomica, but there's another drug that came up, was that antiparine.
That was used for fevers.
It sounded like aspirin to me. And the bromide of potash sound maybe that's from an organic source.
So the antipyrine was used for fever. It had a little relaxing effect, and they probably gave it to her because she was flushed. So this will calm her down a little bit. This will get rid of the fever. In and of itself, it is unlikely to be toxic unless she was taking huge doses. The bromide of potash is a potassium, which is a naturally occurring substance. And that was used as a sedative also. It was an anti-seizure medicine. It's not used any longer, only in veterinary medicine now. It has a very low toxicity. But again, when you start throwing all these things together, even if they didn't kill her, the potential for them to weaken her, and certainly if she was pregnant, in a more vulnerable state.
Right.
When people were known to be pregnant, then was it common to prescribe anything at all for them?
Well, back in the day, I think women just as a baseline were thought to be crazy, hysterical. If you think about the word hysterectomy, the hyster is the root of that, hysteria. And that was basically, you have a uterus, you're nuts. You have nerves, you have the vapors. So I think that certainly for non-working class women, any of the swoons, any of the my nerves were treated with something like that to calm them down.
Okay.
Many women were up to their eyeballs in opium and all those other kinds of morphia was commonly given to women. So in pregnancy, first of all, most women had to shelter at home. You weren't out in the world. This is probably not true for a farm woman in Wisconsin, but a higher class woman, being pregnant meant you had sex, and we don't want to talk about that. So confinement was often to just hide the fact that they were pregnant, and we didn't have to think about it. Imagine having to stay home for months on end waiting for a baby. So to answer your question, lots and lots of things were given to pregnant women. Also, up until not that long ago, there really was a feeling that the placenta was like, no one gets past me, which we now know is absolutely untrue. So back then, they didn't think twice about any of the toxins potentially harming the fetus.
Well, even our moms drank and smoked and...
Oh, definitely.
Whatever.
And what about women in menopause? Did they think they're crazier?
I think that they still do, by the way. I have some stuff about your question about menopause dizziness. So first of all, hormonal changes can do things to you like decrease your blood pressure. So think about it. If you're laying on the couch reading for an hour and the phone rings and you jump up, you might suddenly feel a little dizzy. So that can happen in menopause for no reason. Or you might bend over to get something off the floor and then, oh, you're dizzy. It can affect your blood sugar. So women who are diabetic or have unstable blood sugars, that can be much worse in menopause. So that can make you dizzy. You also can have some palpitations in your heart with the change of estrogen levels. So you can be sitting around talking, you feel ever so fine, and your heart starts beating out of control. So back in the day, where you didn't understand what was going on, and instead of just going, oh, damn, it's my estrogen levels, women got addicted to things, etc. So whether Elizabeth was overwhelmed by being accused of something, overwhelmed by Bertha's death, or whether she was feigning it, there are physiologic reasons that it could have happened. And I'm forgetting how old she was at the time.
She was in her 50s.
So that would probably be the time that it would be more likely fairly early in menopause rather than much later on down the track.
And I don't see her feigning being any kind of weak woman. She was the exact opposite.
Agreed, yeah.
And she herself testified that these spells had been happening to her for quite some time, and they were fairly regular.
Yeah, obviously nobody paid attention to blood sugars or blood pressures or anything in those days. So she could have had any of those physiologic things happening to her.
And would you think that being in a very stressful situation might either bring it on or make it worse?
Absolutely. Absolutely.
Do you think they would have prescribed something for these spells for her?
Absolutely. Much of the same things they gave to Bertha. The antipyrine, because that's the one for fever, but it's also good for anxiety. The feeling in a lot of cases where you shouldn't have any unpleasant symptoms. I don't want you to feel it, but more importantly, I don't want to have to watch it. So here, take this.
We heard after Bertha came to live at Elizabeth's, but before she became really sick, that she might have had a head injury. What do you think about that?
Absolutely possible. A concussion, which just simply means a head injury with the loss of consciousness for a couple of minutes, can make people a little confused and a little out of it for even a number of days. And then if you were mistreated, in other words, you were given some of these tinctures and things that could make you sleepy or goofy, or it would play on itself. You can hit your head and have a slow bleed in your head, but those are far, far more common in old people, not in someone her age. So
Would that have been tied into any of the vomiting?
It's not impossible, but I think it was less likely.
Okay. And plus, she was vomiting before that accident where she fell and hit her head.
Oh, right.
And I don't know if you have questions about the possibility of pregnancy.
Yeah, absolutely.
Interestingly enough, it's amazing to look at medical papers from the 1890s. Prior to the turn of the century, into the 1900s, 90% of women, their pregnancy was confirmed when someone could feel the baby kicking. And it was a presumptive diagnosis based on the changes in their period, but you couldn't confirm it until you could feel what they call quickening. So we're talking up to 20 weeks before people knew they were pregnant. So I read this almost gross paper from 1892 of someone talking about how a way to diagnose pregnancy a little bit early was essentially doing a bimanual exam where you put one hand in the vagina and one hand on the belly and feel the uterus. And it went on for several paragraphs explaining how to do that, which led me to believe that it wasn't a commonly done thing. So I think most women, they would not have a period. They assume they're probably pregnant, and a midwife could look at things like, see if their breasts are changing, feeling if the uterus was a little bigger. But you have to be 12 weeks before that, the uterus is under there and you can't really see it or tell much about it. So all of that to say that if she were only 8, 9, 10 weeks pregnant, it wouldn't be a slam dunk that everyone would realize it.
Right.
And so the question is, was she pregnant? Was she feigning a pregnancy to get Peter to marry her? All this talk on the autopsy, the kidneys and the liver, where's the uterus? You could easily tell in a uterus whether someone was pregnant or if they had been pregnant recently.
That's a missing link in a testimony that we've heard. So she's buried once. Then 5 days later, Peter's brother digs her up to make sure she was dead. Then they dig her up again for the autopsy, where they laid her on the plank in the barn, and they basically just ripped her up. And there is no discussion there about removing organs. However, there is testimony that months after that, after presumably she had been reburied, these various doctors, I think in Chicago, examined her uterus. So somehow either it was removed during the autopsy and we just didn't hear that, or it never happened and Froley paid them and they made it up.
Well, to examine that one would be honestly the easiest, because I said you can't feel it until it's above the pubic bone, but you can certainly see it when you open the body and look at it. It's very easy to tell if it's enlarged. And if she'd had an abortion or a miscarriage, the uterus would stay enlarged and the texture of it and even the shape of it would stay changed for a number of weeks after. So it's almost like the silence speaks volumes, because it should be very clear whether she was or she wasn't.
All right, I'm looking up the exact dates. So she was dug up for the autopsy in May of 1891. My recollection is that the examination, let's just say of the uterus, if it happened, was in July. Is that even feasible? Suppose they did take out her uterus in May. What happened to it between May and July?
Well, the most obvious thing is they would have put it in formalin or alcohol or some kind of a preserving fluid. Otherwise, it would have just been like a brisket that you left out on the counter.
Oh, that's a good image.
Yeah, so this is a good time to talk a little bit about embalming. So embalming never really existed, if you weren't Egyptian, until the Civil War. Prior to that, people died at home the vast majority of the time and were buried immediately on their property. During the Civil War, because people died far from home and families wanted to be reunited with their dead, the process of embalming was started. So she died in 1891. I couldn't find this exactly, but I do not believe it was commonly done for everybody. It would have been an expensive procedure. And again, most people had cemeteries on their property. There would be no reason to embalm somebody and then bury them. So it was really more like if you died in New York City and you wanted to go back to Wisconsin to your family, they would have embalmed you. So I'm going to make an assumption. I'm guessing it would be unlikely that she was embalmed.
They didn't have a lot of money.
I think that's fair because money was a big deal. They did not have it.
And also the time frame. She died on the 1st and she was exhumed on the 7th. So that's only 6 days in between when she died and when she was dug up.
The first time.
Yeah.
I can't help thinking, what's the percentage of people that are found to be alive after 6 days? I mean, if you're in the ground for 6 days.
If you weren't dead when you went in, you are now. That was a big deal also. People were buried with bells.
Oh, yes.
Right. She died on the 1st of April and the autopsy was the 14th of May. So that's a good 6 weeks. The body may not have changed a lot if she was wrapped in a shroud and in a box to prevent rodents or bugs or anything getting to the body. But her organs would have begun to soften and get kind of gooey. So they wouldn't have been in the best shape. But what would happen is they would be taken out and put into a jar with a fluid in them that would preserve them. There are organs that are 100 years old in museums in the UK because they're in a liquid. In terms of how good that would be to take tissue from it and test it, I can't answer that. But my guess would be it would be pretty hard to isolate a toxic substance if it had already been sitting in a jar of fluid. But to look at the organ, you could see fatty changes in the heart or the liver. You could see an enlargement in the uterus. And certainly if you cut into the uterus, you could see a fetus, even if it was 6 or 8 weeks along. So I don't know what to say, except I wonder if they really looked at it or if they weren't trying to hide something about it.
They met in January. Her husband and her.
They married on the 21st of February, and she died,
April. She could have been 4 months pregnant.
I mean, absolutely.
Her mother, I think, was the one that testified that she thought she had used tools to have an abortion. So wouldn't that have been obvious in an autopsy too?
Would have been very obvious, and she almost certainly would have bled to death from that. And when you talk about blood on the sheet, it would have been a mattress soaked with blood, et cetera, et cetera. So I don't think a 17-year-old girl would have had the ability to do that. I'm not saying it didn't happen, but it would be very, very, very evident.
But we have that evidence of the blood-soaked mattress.
Oh, I thought it was just a sheet in the barn.
No, it was the entire mattress.
Oh, I missed that. So
that was so filthy that they put it immediately after her death out in Elizabeth's chicken coop.
Yeah, so if she had a botched abortion, I would say she would have either bled to death within hours or a day or infection within a week at the most. And it would absolutely be extremely obvious on autopsy.
Well, we heard last time that Bertha's own mother is the one that testified that she believed that she had been pregnant and had attempted abortion. And they asked her, well, did you speak up and say this? And the mother's answer was, no, I didn't tell anyone. And at first we thought, really? But then that actually makes sense because this community was full of people that lynched people if they varied from social norms. And back then it would have reflected on the family, not only the pregnancy, but of course, the abortion attempt.
And so maybe they were trying to cover that up.
Yeah, I mean, it would be very convenient if Elizabeth killed her with arsenic because that would take everything off of the family being associated with an abortion.
Mm-hmm.
Right.
I also wanted to talk very quickly about the kidney. There are two things about the kidney that struck me. One is that when she had the fall in the carriage, she struck her back, which could have involved harming the kidney. And the other is an infection of the kidney, what's called pyelonephritis, which can cause nausea, vomiting, low blood pressure, lots and lots of pain, fevers. You absolutely could die from pyelonephritis untreated especially if you were pregnant. As far as the injury, you could have what's called a contusion, a bruise on the kidney from the fall, which can be extremely painful. And she was talking about back pain. That can cause blood clots that can screw up the kidney. So where the hell is the kidney in the autopsy? So there's a lot of the story that probably lost to the sands of time, I'm afraid.
Mm-hmm.
Was there anything normal about this autopsy process?
Certainly in the early days, even in the Victorian age in the UK, autopsy was considered to be a sin. It was really a horror to do an autopsy. So I don't think it was commonly done. Not that they didn't know what they were doing, but they were still bleeding people and using leeches and all kinds of other things.
And then the one doctor that I think is interesting is Dr. Asham. Like his testimony was that she was fine like a week before she died. He's like, I don't even know why they called me.
Yeah. That would rule out things like probably head injury, kidney infection. It could be that she had a little injury. She was unwell after her fall and she was starting to heal and somebody killed her.
Or how about she was just pregnant and these symptoms come and go?
Yeah, if any of you have been pregnant, you can feel pretty lousy for the first trimester and then start to feel better. So it's certainly possible that she had morning sickness type symptoms that were over medicated and over treated and then started to feel better.
Or she had the abortion after he left and then she died in a week. Did anyone do any follow-up questions on the abortion statement by the mother?
She thought it would be shameful.
Right.
Wild. You would think someone would have said, well, whose tools were they?
How about this? What if Elizabeth didn't poison her with arsenic, but Elizabeth helped her do an abortion?
Yeah.
Right. Or even her husband. Didn't he act odd too?
Yeah.
Yes. There's a lot of discussion about how uncaring he was sitting in the courtroom during this whole trial, just smirking.
Interesting.
Well, remember, he had everything to gain by both Elizabeth going down because she was his tormentor.
Oh, right.
Yeah.
And then it's reasonable to think that given the circumstances of their quick and very weird marriage, that maybe that was not his first choice either.
Who knew arsenic was everywhere? And I don't know how these people functioned because they were all like drunk all the time and on drugs and the arsenic.
You know the whole thing about apple cider, Johnny Appleseed? Well, water back when Johnny Appleseed was roaming around was almost always tainted. Wells were poisoned by the septic, people pooping everywhere. And so nobody drank water and they had cider and cider quickly turned hard, guzzling hard cider. So basically all of our ancestors were drunk.
I never would have thought of that.
Anyway.
It's great. Nice meeting you, Judith.
Thank you so much.
Doppelnamers is a production of Harriet's Guides, LLC. Our theme music was composed and performed by Mary Jean Stead, orchestrated and arranged by Janine Lynn Claps. The Doppelnamers logo was designed by Kay Lum. Thanks to my co-hosts, Mary Jean Stead and Kathy Boyle Almeida. Thanks to the Wisconsin State Law Library, the Wisconsin Historical Society, the archivists at the University of Wisconsin-Eau Claire, and the University of Wisconsin-La Crosse. Take care, Doppelnamers.